At the annual National Foundation for Infectious Diseases flu press conference, experts in a variety of specialties discussed recent vaccination statistics and the outlook for the coming flu season.
I think it's absolutely essential for healthcare workers to be vaccinated against influenza each and every year. I think it's an ethical and a professional responsibility. There are two reasons. The first is patient safety. We don't want to transmit our influenza virus to our patients, many of whom are already sick. And then the other, of course, is when influenza strikes, we have to be vertical, not horizontal. We have to be ready to provide health care, so we need to be protected.
And what tips do you have for clinicians to make sure that their colleagues and everyone who works in their offices are also vaccinated?
Well, the way for clinicians to organize for everyone in their staff to be vaccinated is, number one, be vaccinated yourself. And then you must be vaccine insistent. You have to say, we do this for our patients. I expect everyone in this office to be vaccinated and protected so we can protect our patients. And then they have to remind them, the vaccine doesn't create flu. You can't get flu from the flu vaccine, and it is safe and effective. So do it yourself, insist on it, and then explain why.
Last season was a really unusually mild season. It was about the lowest amount of influenza that we had had since 1982, which is when we first started collecting information about it. We don't expect that to happen again this year. Last year, a lot of the strains that were circulating had been circulating for a while. This fall, we are expecting to see new strains appearing. A new H3N2 is likely to show up, and a new influenza B. And so for that reason, this year, we really think that physicians need to promote getting vaccination, because that's the best way to protect your patients, to protect yourself, and to protect your loved ones.
Any suggestions for how clinicians should continue to promote the flu vaccination throughout the entire season?
Well, we know that when we did some surveys to find out what gets the highest coverage, say, among pregnant women, we find out that doctors that recommend the vaccine and who have the vaccine available actually lead to the highest level of coverage. And so for that reason, doctors need to be recommending it. They need to get vaccinated themselves and tell that to their patients, and they need to have the vaccine available in their office so that at that point the patient actually can get vaccinated. That's the best way to do it.
What are some strategies that clinicians can use to promote vaccination in adolescents who are traditionally hard to reach?
Well, we need to go to the places where they're not so hard to reach, which is media. Posting things on Facebook, posting things on Twitter would be very helpful. I think that pediatricians can do that from their offices, their staff can help with that, their children can help with that. And to remind adolescents that they don't want to get the flu because it will take them away from school, it'll take them away from their social activities, it'll take them away from their athletic activities, and that can all be prevented by vaccination. So we role model by being sure that their healthcare providers are vaccinated. We go to the schools and partner, I think, with coaches, with teachers. We go to after-school activities that some of the kids are doing with dance or music or other features, and make sure that their instructors and coaches and teachers are themselves immunized, and then encourage the adolescents to be immunized as well. And we shouldn't forget the parents. Parents are still parents even when their children are adolescents, and the parents should be immunized themselves, take the children along, the adolescents along with them so that the family's vaccinated. Particularly important in a family where the adolescents might be babysitting for their own younger siblings or are babysitting for a little extra cash with other children who may be babies who are too young to be vaccinated themselves. So if you throw all that together by going to the media that the kids pay attention to, by going to their coaches, to their teachers at school, by looking at their faith communities and making sure that the groups that they might be in through their faith community are promoting vaccination, we can reach everybody. Now, some of them are still going to have that adolescent feeling that, oh, I'm not going to get the flu, nothing's going to happen to me. We have to be able to tell them, no, it could happen to you, and if it does, it's going to really interfere with your life, both at school, in sports, your social life. I think that will get their attention.
For IMMG Medical Media, I'm Heidi Splee.